Hello, everyone. Welcome to this new webinar about Bioptron hyperlight devices. As you know, Bioptron devices can be used at home by private customers who would like to follow their own self-treatment at home or to continue at home the treatment provided in a healthcare institution. But also, it can be used by professionals in hospitals, healthcare institutions, and nurse homes, where people will not treat themselves. Hospitals don't buy products. They buy solutions that improve patient outcome, reduce cost, and streamline clinical workflow. Today, we will see how to use Bioptron in this context and provide you tips about the information to provide to these healthcare professionals. As you know, Bioptron devices is a family of 3 devices which has different size to adapt to the needs of every patient. The smallest one is Medol. The filter has 5 centimeters of diameter, and it's intended to be used more generally by private customers. Of course, it can be used alone or with the corresponding fluorescent. The middle model is Bioptron Pro 1 or B Pro 1. The filter has 11 centimeters and can be used by private customers that will like to treat bigger areas at home, but also in clinical settings, as we will see. Of course, it can be used with the table stand coming with the device or with a floor stand. And the third and biggest model is Bioptron 2, also called B2. The diameter is much more bigger, so 15 centimeters, and it's intended to be treated in hospital and in clinical settings, of course, alone and with the corresponding floor stand. For evident reasons, we will focus today in Bioptron Pro 1 and B2 because those are the devices that are more suitable for clinical settings. As a reminder, and also arguments that you can use with healthcare professionals, are the characteristics of the light of Bioptron devices. Bioptron devices emit a very specific light that will trigger a specific cellular mechanism. As a reminder, a Bioptron light is polychromatic. That means that it emits light between 350 nanometers until 3400. This is very important because it does not contain UV. Bioptron devices do not provide UV, but they provide all the visible spectrum, so all the light that our eyes are able to see, plus infrared, which is very important because it provides a very wide range of wavelengths. Bioptron light is incoherent. That means that each wave of light, they will follow their own wave. They will not be in phase. So this will provide a light that is very safe. It's non-invasive. Of course, it will not create pain. And which is very important, it will allow this efficient healing process. Bioptron light is low energy. That means that this is in the range of energy which is enough to trigger the cellular mechanism that we will see later on, and is a consistent light during the whole treatment. The fourth characteristic of Bioptron light is the polarization. More than 95% of the light emitted by our devices is going in parallel planes. This is very important. This is depolarization because it allows an optimal light penetration in the tissues, and thanks to the fullerene molecule containing in the glass, it will optimize the interaction with specific biomolecules. Of course, it's the combination of these characteristics that will optimize this cellular biostimulation. And the fifth characteristic of the light of Bioptron, that sometimes we forget about it, is that Bioptron devices provide very bright light, more than 10,000 lux. And this is very important, as we will see, to modulate the biological rhythms, and it will be very important to fight depressive-like symptoms. Of course, which is important to you to explain to healthcare professionals is explain them how the device works. As I explained you before, I advise you to focus in B Pro 1 and in B2 because they are more adapted to treat dozens of people per day. I advise you to explain to the healthcare professionals to describe the device, how they can use it. Of course, you can use the instructions for use, because in both, it's explained each part of the device and how to use it. It's very important to highlight that these devices are very user and patient friendly. That means that it will be very easy to use for the nurse, for the healthcare professional, but also it will be very pleasant for the patient. So it will be easy for both to use Bioptron devices. And which is also important to point out is that Bioptron devices do not need consumables or other additional expenses. That means that once this clinical or healthcare institution purchase a Bioptron device, they don't need to pay anything else. There is no pieces to be replaced. There is no specific treatment to maintain the device, etc. Because this will be very important for them. As you know, Bioptron devices have multiple medical certifications. We will go through all of them, and I will give you tips and advice in how to approach healthcare professionals in the medical domains for which Bioptron is medically certified for wound healing, for pain treatment in different domains, for dermatological issues, but also the use in pediatrics, and to fight these depressive symptoms in seasonal affective disorder. Another tip that I give you is that you need to explain to these healthcare professionals that Bioptron are medically certified devices. So in Europe, of course, we have the CE mark, which shows that we are compliant with European regulation. But we have also the clearance for FDA, United States, that we have our MDSAP certificate for United States and Canada for pain management, and that, of course, we are compliant with ISO 13485. Those are proofs, real proofs, international known proofs, the regulatory definitive proof that Bioptron devices are medically certified devices. And this is a very strong argument that you need to use with these healthcare professionals. The goal of Bioptron is to serve as a powerful treatment that will accelerate the natural biological processes. The objective is to offer a solution that works, of course, and that eliminate addition of other treatments, and of course, that avoid side effects. Or sometimes it works an adjunctive therapy that will help other therapies to work better. It will have a synergic effect. So now I will give you some arguments about the mechanisms that are triggered by Bioptron that are very useful for each medical domain. So you will be able to explain that to healthcare professionals and explain them which are the cellular mechanisms triggered by Bioptron and how each of them contribute for each medical domain. And I will give you these lists that can be used in function of the specialty that you are approaching. If today you are approaching a unit of wound care, you can use these cellular mechanisms and explain them. Or if you are approaching, as we will see, a spa or a beauty salon, you will use the ones for dermatology. As you will see also, the cellular mechanisms will be repeated. Why? Because the cellular mechanisms that are triggered by Bioptron, they are always the same. The device itself, it doesn't know if you are treating a psoriasis or you are treating a wound. The light will make the effects in the tissues, but of course, if you are treating a wound, you will see the closing of the wound. If you are treating an acne, you will see the decrease of the acne symptoms. Of course, if you are treating a wound, you will not see an improvement in the acne because there is no acne, but the cellular mechanisms are the same. For wound care, the objective is to close the wound and to avoid complications in the future, avoid pain for the patient. So you will explain to the healthcare professional that how Bioptron will help with the wound care. First, it will be improve the fibroblast proliferation. This will have a very nice effect because it will accelerate this regenerative process. It will help to close the wound. Of course, it will increase the collagen production, which is very important to optimize this regenerative process. But as you will see, the fibers of collagen, they are very well organized, and we will avoid this hyperescarification or keloids that we can observe in the future as a secondary effect. It will improve the microcirculation, and this is very important because the blood flow will apply everything that needs for these new tissues that are being regenerated. It will reinforce the immune system, and this is very important to decrease the risk of infection, but also to avoid that the wound is opening again. And of course, as you know, Bioptron is decreasing the release of pro-inflammatory cytokines. So we are decreasing the inflammation during the whole process. So all these cellular mechanisms that will be improved, accelerate, and optimized in the healing of a wound thanks to the use of Bioptron, it will accelerate the healing and it will decrease the pain. If you are approaching a unit about pain management, unit or a service or that it's taking care of pain management for different domains, as we will see later. Once again, Bioptron will decrease the nociceptive signals. So the nociceptive signals are the signals that transmit the pain sensation. We are decreasing these excessive signals. It will increase, for example, the nitric action, which is nitric oxide action, which is a molecule that is known to decrease the pain also. And as we saw before, it will accelerate the regenerative process. So if you are treating a tendinitis or lesion of the muscles, etc., it will not only decrease the pain, but also accelerate the healing, increasing the collagen production, improving the microcirculation, which is very important to accelerate the regeneration, but also to decrease the ischemic pain, and also, of course, decreasing the release of pro-inflammatory cytokines that will favorize the inflammation. So in that unit, physiotherapy or chronic pain, you will have, of course, a decrease of the pain or complete elimination, but also improve the mobility. Sometimes it's not only decrease the pain and we decrease the symptoms, but also to improve the mobility of the joint that could be affected. If you are treating a tendinitis, for example, it's not only to decrease the pain, but to improve the movement of the shoulder or of the elbow, improving the quality of life of these patients. If you are approaching a unit that is treating dermatological issues, psoriasis, dermatitis, acne, also in beauty salons, once again, you will explain them that Bioptron is improving the proliferation of fibroblasts, so accelerating the healing and the regeneration of the skin, improve and increase the collagen production, very important for the tone and the density of the skin, but also to avoid marks, very important in the case of acne, for example. Improving microcirculation, so it will accelerate this regenerative process, improving the tone. It's reinforcing the immune system. Very important also in case of acne, in which we need to fight with a specific bacteria that can promote the acne proliferation. And of course, decreasing the inflammation. Very important in that case, or also in dermatitis and psoriasis, in which there is a chronic inflammation in these plaques. So you will improve the symptoms and avoid that they come again and again. And if you are approaching a mental health unit, very important nowadays, we start to realize the importance of the mental health. It fights against depressive-like symptoms. You can say to the healthcare professional that state of the art right now for the seasonal affective disorder and for other depressive-like symptoms, light therapy, it arises as one of the best therapies without side effects to fight these depressive-like symptoms, because it coordinates again the biological and the circadian rhythms. So, of course, we will improve the symptoms. Once you have provided all these clinical and medical arguments, you can, of course, to highlight the key advantages of the use of Bioptron in these setups. Of course, superior clinical efficacy and faster recovery. The bottom line for any hospital or clinical setting is getting patients healthy and discharged faster. So thanks to Bioptron hyperlight therapy is clinically proving that we accelerate the healing process across multiple departments, as you saw before. For wound care and surgery, we are accelerating the healing, decreasing the risk of infection, decreasing the side effects, improving the quality of life of patients, improving the pain management, improving this decreasing pain, improving motility, this rehabilitation that will improve the quality of life of patients. So Bioptron has a very clear effect. But also Bioptron is very economic, efficient device, and also it will allows a very fast return of investment. In today's healthcare environment, economic therapy is a major selling point. Bioptron doesn't need consumables. As I told you before, unlike other medical technologies, Bioptron does not need expensive recurring consumables, which can make it a long-term cost for the hospital. In that case, the long-term cost of the ownership of a Bioptron device is exceptionally low. It will also reduce the bed days. Of course, if you accelerate the wound healing or the motility of a patient, a post-surgical recovery, the hospitals can improve the bed turnover rates faster. Also, it provides a low staff burden. As I told you before, the devices are user and patient friendly. The devices are very ergonomic, very easy to use, with very short treatment times, as you know, between 4 and 10 minutes. You have fantastic results. You don't need a nursing staff for extended period using the device. Bioptron devices are have a big versatility. With one device, you can use it for multiple departments. Bioptron devices are not a single-use asset. It's a multidisciplinary tool, as you have seen, that can be moved from one unit to the other one. You can use it in pediatrics and neonatal units because Bioptron can be used for all ages. It can be used in dermatology, for wound healing, for pain management. So you can, with the same device, you can use it for different units. And finally, but not last, safety and compatibility. One of the biggest hurdles in a clinical setting is the risk of side effect or contraindication. Bioptron has no side effects. It has a safe profile. We don't have any side effect using this type of light that is 100 UV free, which we ensure the patient safety. Of course, this can be also a study thanks to the huge clinical data that we have that not only prove the performance of Bioptron, but also the safety. It's non-invasive and it's painless. And this will, of course, increase the patient compliance and satisfaction. And it will be easy also to use in palliative care or in pediatric units. And as we discussed before, it will allow this global care synergy. It is fully compatible with existing pharmacological and physical treatments. That means that the doctors or the hospital don't need to change the primary protocols. They can just enhance them and increase the positive clinical impact for the patients, but also for the staff. With all the arguments that you have now from previous slides, now I will explain you a little bit which specific units you can approach to sell the devices and that they can, of course, benefit from Bioptron effects. You can approach hospitals. In which units in hospitals Bioptron can be very helpful? For wound care, in units of wound care, because they can use it in burn units, for the burns, for the skin grafts. In surgery, after grafting or after to treat the wound, after surgery. Of course, in maternities also to help the mothers with after a C-section or an episiotomy, for the cracked nipples if they decide to breastfeed. Also for carpal tunnel syndrome, it's a very common symptom of pregnant women. And also for palliative, for these chronic wounds or people that needs to have a better quality of life. In hospitals, you can also approach the mental health units. You can help the patients there for seasonal affective disorders, but also to help another pathologies with depressive-like symptoms. And of course, you can approach these pediatrics units to help them with these dermal issues that they can have the newborns. In hospital, there is no so much pain management. In general, they will send the patients to these physical rehabilitation centers. And in that cases, you can approach them for wound care. Okay, there are people that will go there to manage their scar or a surgery. After a surgery, they will need to treat the pain, they treat the wound, also to have some rehabilitation. So Bioptron can be very, very beneficial there. In a physical rehabilitation center, you can, of course, take care of the pain for different reasons. You will have people there that are making therapies because they have chronic pain due to rheumatology, due to osteoarthritis, this chronic arthritis. It cannot be cured. There is nothing that cures them, but Bioptron can help them to decrease the pain, improve the mobility, of course, and improve the quality of life. Also for physiotherapy itself, people that are going there because they have low back pain, shoulder and neck pain due to different pathologies, carpal tunnel syndrome, for tendinitis. All these pathologies can be treated with Bioptron in combination with other treatments, of course, in these physical rehabilitation centers. And of course, sports medicine. A lot of people are going there because they have a muscle lesion or they need to improve their recovery. They have soft tissue injuries, tendinitis, etc. Bioptron can be very helpful also in these cases. And in pediatrics, of course, in these centers, there are people, in general, there are more adults and elderly, but we can find also kids that after a surgery or that they have these musculoskeletal disorders and they need to do specific movements to improve their quality of life and their mobility. Bioptron can help them quite a lot. So you can use Bioptron for different aspects in these physical rehabilitation centers. Also in nurse homes, we had a webinar specifically dedicated to that. In these nurse homes, when we have a lot of elderly people, you can help them for different options. In wound care, if these elderly had a surgery, to help them to accelerate the wound after the surgery, after burns. Also, of course, in chronic wounds, unfortunately, these people have this diabetic foot ulcer or pressure ulcers. They have the health that is quite weak. Even in that cases, Bioptron can help them to improve their quality of life at any time. Of course, for pain care, in general, it's very often that they have this chronic painful pathologies, osteoarthritis, arthritis. You can help them to have less pain, to increase the mobility, which will be very good for them because you promote the autonomy. When they do physiotherapy exercises for low back pain, shoulder and neck pain, carpal tunnel syndrome, lesions that they can have, Bioptron can have a global approach to decrease the pain in this population. And for dermatology, it's very rare that they will have acne, but of course, very often they have dermatitis, psoriasis, they can have some superficial bacterial infections. So Bioptron can help them also in these cases. As you can see, once again, with one device, you can treat quite a lot of medical problems and within different domains. And of course, mental health to fight some depressive-like symptoms or when they feel not very well, Bioptron can help them to boost them. For dermatology, not only for pathologists, but also in beauty clinics, in spas, in beauty salons, that will be more for anti-aging purposes, to have a better state of the skin, or after an aesthetic surgery. Once again, Bioptron can be used for wound care after a surgery, or after some PRP treatments or dermal filler injections, other aesthetic treatments that can let some marks. Bioptron, as you know, will decrease the inflammation, the pain, and will improve even more the effect of these treatments. Also to treat scars, in case there are scars of acne or scars from an old wound. In pain care, there are people that are going to spas also to feel better. Bioptron can approach the eventual pains that they can have, low back pain, some small lesions, or just because they want to feel better. And to treat some dermatological issues, as we say, for psoriasis, acne, dermatitis, and just for a global anti-aging treatment to treat the wrinkles, the expression lines, etc. For global well-being, as we say, they don't need necessarily to have a mental pathology, but it can be used for global wellness. Once you have given all these arguments to these clinical settings, they can perhaps ask you more specific questions about clinical trials, how to use the device, and then those are, of course, some examples. We have an extensive literature that I cannot explain you all today, of course, but you can give them this small information that can give a whole idea about the treatment of Bioptron. For wound healing, as I told you, you can approach hospitals, you can approach nurse homes, you can tell them the huge list of bibliography that we have for wound healing in different type of wounds, as you can see here, burns, post-surgery burns, injuries, chronic wounds, etc. And you will explain them, as when you explain the device themselves, that the treatments are between 4 and 10 minutes at a distance of 10 centimeters, once or twice a day, in function of the protocols that they have in the hospital or in the nurse homes, and very important, compatible with other pharmacological and physical treatments. If they have a patient that underwent a cardiac surgery and he needs to take specific painkillers or other medicaments or dressings, fine, they should follow with their protocol. They just add Bioptron and the results will be even better. You can, for example, give them this example about burns in this clinical study. As always, two groups comparing traditional burn care, as they do normally in the hospital, and the same protocol with Bioptron for 4 weeks, and they check the wound surface area and the bacterial colony quantification because it can become infected. And as you can see here, as always, in blue, it's the Bioptron group, in gray, the control group. The wound surface decreased much more with when they were adding Bioptron. So more than 55% of the wound reduced the surface against even not 40% in the control group. And the bacterial quantification is the same. It decreased much more in the group that was treated with Bioptron. So this is the proof that Bioptron accelerates the wound healing, prevent the descent, so the opening of the wound again, and other complications that could be infections because it decreased the bacterial colony. Those are some examples that you can give, but you can use any other study that we have here. I'm just giving you some examples. Also for chronic ulcers, if you are approaching a nurse homes, that they will have quite a lot. Once again, a standard treatment for the wound care for diabetic foot ulcers, one control group, one group in which they added Bioptron, and the results are very similar. You can see here that the ulcer surface decreased more than 40% in the case of patients treated with Bioptron, and 25%, only 25% in the case of patients that were not using Bioptron. And the ulcer volume, it was the same. You can see that the volume of the ulcer of patients that treat with Bioptron decrease almost 60% against even not 32, so almost the half in the patients without Bioptron. So Bioptron will accelerate the wound healing and decrease the pain during the whole process. Those are some examples that you already know that you can show to the doctors. You can use the brochure that we have to show visually the effects of Bioptron. Also for pain management, you can approach hospitals, physical rehabilitation centers, nurse homes for the treatment of Bioptron in different domains. In rheumatology for chronic issues, in physiotherapy for pain in different joints, sports medicines for different muscle and tendon lesions, also for post-surgery pain, as we saw for the C-section or other issues. Once again, we have quite a lot of studies in each of them, in each of these medical pathologies. You can use that as proof, and then you can explain them some of these studies to give them an idea that these studies exist and show the performance and the safety of medical certified Bioptron devices. That case of osteoarthritis, again, control group treat with an anti-inflammatory cream, control group, yes, Bioptron group with this anti-inflammatory cream plus Bioptron, and they did different tests to check the mobility, to check the pain, the quality of life. Once again, you can see that the decrease in the pain was observed in the group treated additionally with Bioptron, no difference in the control group. This is the time to walk 15 meters. Since they have less pain and more mobility, they decrease in 20% the time to walk these 15 meters. And also, as you can see here, there are decrease in this Oxford and WOMAC scores, which measure the quality of life. It was an improvement in the joint function with reduction of pain, of stiffness. So Bioptron has a very positive global effect in the osteoarthritis and in the mobility and quality of life of these patients. Also, as we say, for post-surgery pain, post-surgery will have double effect, pain relief and acceleration of the wound. Once again, same protocol as in the other ones, comparing a group with Bioptron and another one without Bioptron. You can see here that with Bioptron, the pain decreased much more. So it was an improvement of 261% in the group of Bioptron with a 100 improvement in the control group. So these ladies, after the C-section, they accelerate the wound, but also they have more than the double less pain than the ladies that didn't receive Bioptron. Also in these rehabilitation centers, that it's there that you will find most low back pain or these nurse homes. Once again, thanks to adding Bioptron to the therapy that the healthcare professional decide for this patient, in the group of Bioptron, the pain was always lower at any time point, and also the quality of life. It improved the mobility and the quality of life of these patients. So once again, you can give this little information to healthcare professional to explain just some of these clinical trials that we have. In the domain of dermatology, we divided like in two blocks, if you remember, more dermatological issues, atopic dermatitis, rosacea, psoriasis. This is more for beauty salons or for dermatologists that you will approach for that. There is no so much treatment in hospitals, more as we saw, spas or dermatologists, cabinets of dermatologists that can help you a lot. It's very easy to use, once again, between 4 and 10 minutes at a distance of 10 centimeters. It's very similar to all the domains that we saw until now, and it's mainly compatible with other treatments. Once again, here you can see that for the psoriasis, they added in one group just Bioptron, and you can see that the score for the psoriasis decreased in 43% in patients treated with Bioptron, with only 9% in control group. And then in the skin thickness, because in the psoriasis there are these plaques that became with the skin a little bit inflamed and very thick, you can see that in that case, not only the symptoms decrease, but also the state of the skin It decreased around 47% in the group treated with Bioptron, only 3% in the control group. So you can see that the state of the skin will be much better when adding Bioptron. You can, of course, use the brochure that we have in dermatology to show these examples that are more visual, perhaps. And this was only with Bioptron. You will need perhaps 5 or 7 days to see visually an effect, because we cannot go faster than the biology, but you need to be constant to have these fantastic effects in all these pathologies. Also in dermatitis, this is something that perhaps they will treat a lot of, for example, kids or adults that they try everything and nothing is working. Just they can use the normal cream that they are using if they wish, just adding Bioptron. You can see here how the skin thickness decreased in both cases, but this skin thickness reduction, once again, in the dermatitis, there are these plaques, it was much more decrease in the group treated with Bioptron than in the control. So it improved the dermatitis symptoms, but once again, with an excellent safe performance profile. No side effects, no complications. And finally, when you are approaching these mental health institutions, that I think is the moment to go in hospitals or in institutions or in psychology, if there are cabinets of psychologists, we have proof that Bioptron decrease the depressive-like symptoms. You can use it in a different way, is between 20 and 40 minutes at a distance of 20 centimeters, or then you can increase the distance, but increasing also the time, once or twice a day, for as long as needed. If they need to use it for 6 months or for 8 months, it's completely fine. There is no side effects and there is no dependency neither. Just to let you know that the use of light for this seasonal affective disorder to fight these depressive symptoms, the most effective treatment that is used right now is light therapy. And Bioptron is ideal because it provides the whole spectrum. So all the colors of the light are very bright, more than 10,000 lux. So in that study, you can show that a specific tests to measure these depression-like symptoms were decreased thanks to the use of Bioptron. So I hope you have now a global overview about all the medical indications for which Bioptron can be used, which institutions you can approach, hospitals, nurse homes, rehabilitation centers, which units specifically in these institutions, and which are the arguments that you can give to these healthcare professionals, from a regulatory point of view, providing the information about the all certificates that we have, about all the clinical data that we have, the spectacular safety profile of Bioptron devices, also all these economical arguments that we provide you to give, because as you saw, this is very important for healthcare institutions, and of course, all the uses that you can give to Bioptron. Once again, this is very important that you know all the arguments that you can use, because today we have shown you that it's a tested and clinically proven device with a very safe profile, very easy to use for patient, but also for the healthcare professional, short-term and long-term low expenses because there is no consumables. They can use the same device in different units through the same institution. With very short treatment times, you have fantastic results, and it can be used for all ages. And of course, it's a Swiss made medical device that it's a high quality stamp. So I hope you enjoyed the webinar. Thank you very much for your attention, and I hope to see you very soon. Thank you. Bye.